When someone has a stroke, the first few minutes determine everything. A stroke arrives without warning. Suddenly, the person can't walk, can't speak properly, becomes confused. One side of the body stops responding. If you're nearby when this happens, the fear is real. Most people know this is serious, but they don't know what to do, so they freeze or make wrong choices that cost time. But here's what you need to know. A stroke is a race against time. Every minute that passes, neurons die. The damage increases. The chances of recovery decrease. Acting fast isn't a recommendation. It's survival. A stroke happens when blood flow to part of the brain stops. Sometimes it's a clot blocking an artery. Sometimes it's a blood vessel bursting. Either way, brain cells start dying within minutes. The longer the brain goes without blood, the more permanent the damage. Speed matters more than almost anything else. So if someone next to you is having a stroke, you need to know two things: what to do and what never to do. Have you ever helped someone having a stroke? What was the first thing you did? Share your experience in the comments. Let's break down what to do and what to avoid if someone is having a stroke, step by step. Step 1. Call 911 immediately. The moment you suspect a stroke, call 911. Do not wait to see if symptoms get better. Do not call the person's doctor first. Do not drive them to the hospital yourself. Call 911 right away. People often resist this because they think driving will be faster, or they don't want to bother emergency services for something that might not be serious. Both thoughts are wrong. An ambulance will get there faster than you think, and paramedics can start treatment immediately. They have equipment and training you don't have. They can give oxygen, start an IV, monitor vital signs, and communicate with the hospital so the emergency room is ready when you arrive. The hospital can have a stroke team assembled and a CT scanner ready. If you drive, none of this happens. You're just sitting in traffic while brain cells die. Ambulances also get priority at hospitals. When you walk in through the emergency room entrance, you wait in line. When paramedics bring someone in, treatment starts immediately. This time difference can mean the difference between getting clot-busting medication in time or missing a window. For ischemic strokes caused by blood clots, there's a drug called TPA that can dissolve the clot, but it only works if given within a few hours of symptom onset. Step 2. Use the word stroke when you call. When the 911 operator answers, say you think someone is having a stroke. Use that exact word. Don't say something is wrong or they're acting strange. Say stroke. This matters because it changes how the emergency system responds. Stroke protocols kick in immediately. The dispatcher will send paramedics who know what they're dealing with. The ambulance will go to a hospital equipped with stroke specialists and imaging equipment. The hospital will have people standing by. All of this happens because you used the right word. If you're not sure it's a stroke, say so, but still use the word. Say, I think this might be a stroke. The dispatcher can help you figure it out. They would rather respond to a false alarm than miss a real stroke. Step 3. Check for symptoms using FAST. There's a simple test anyone can do to check if someone is having a stroke. It's called FAST, which stands for face, arms, speech, time. Face. Ask the person to smile. Look at their face. Does one side droop? Is their smile uneven? In a stroke, facial muscles on one side often stop working, so one side of the mouth stays down while the other goes up. Arms. Ask them to raise both arms and hold them out. Can they do it? Does one arm drift downward? Stroke often causes weakness on one side of the body, so one arm will drop while the other stays up. Speech. Ask them to repeat a simple sentence like, "It's a sunny day." Can they do it? Is their speech slurred? Are they using wrong words or nonsense words? Stroke often affects the parts of the brain that control language, causing obvious speech problems. Time. If you see any of these signs, you're out of time. Call 911 immediately. Don't wait for more symptoms. Don't wait to see if it gets worse. One positive sign is enough. Beyond these 3, watch for other symptoms: sudden confusion, trouble seeing in one or both eyes, trouble walking, loss of balance, severe headache with no known cause, numbness or weakness, especially on one side. Step 4. Note when symptoms started. The single most important piece of information you can give doctors is when the symptoms started. They need this to decide what treatments are safe to use. Some treatments only work within certain time windows and become dangerous after that. Look at a clock and remember the time. If you're not sure exactly when symptoms began, try to narrow it down. Was it in the last hour? The last 3 hours? If the person was asleep and woke up with symptoms, doctors need to know when they were last seen normal. This determines their treatment options. Write this time down if you can. In the stress of an emergency, details get fuzzy. Having it written down means you won't forget or misremember later. Step 5. Gather medical information. While waiting for the ambulance, collect information about the person's medical history and medications. This helps doctors make faster decisions about treatment. Find out or write down all medications they're taking, including supplements and over-the-counter drugs. Known medical conditions like high blood pressure, heart disease, diabetes, sleep apnea. Any allergies, especially to medications. Recent surgeries or medical procedures. Whether they've had strokes or heart attacks before. If the person is conscious and can communicate, ask them these questions directly. If not, look for medication bottles, medical alert bracelets, or call a family member who would know. Every detail helps. Step 6. Talk to the person. If the person is still conscious, keep them calm and talk to them. Tell them help is coming. Ask them questions to gather information, but also to keep them engaged. This serves 2 purposes. You get information doctors need, and you can track whether their condition is changing. Stay calm yourself. The person is probably frightened. If you're panicking, they'll panic more. Speak slowly and clearly. Be reassuring but honest. Don't tell them everything is fine, but do tell them help is on the way. Keep checking if they can still respond. Are they answering questions? Are their answers making sense? This tells you if things are getting worse. Step 7. Position them properly. If the person is sitting or standing, help them lie down on their side with their head slightly elevated. This position helps maintain blood flow to the brain and reduces the risk of choking if they vomit. Do not move them if they've fallen and might be injured. Moving someone with a spine injury can cause paralysis. If they're on the ground and seem injured from a fall, leave them where they are, unless they're in immediate danger. Loosen any tight clothing around their neck and chest. Belts, ties, collars, anything restrictive should be loosened. This makes breathing easier. If they're conscious and comfortable where they are, don't force them to move. The goal is comfort and safety, not following rules exactly. Step 8. Perform CPR if needed. Some people lose consciousness during a stroke. If this happens, check if they're breathing and have a pulse. Put your ear near their mouth and nose to listen and feel for breathing. Put your fingers on their neck to feel for a pulse. If they have no pulse and aren't breathing, start CPR immediately. CPR is a life-saving technique that can really make a difference. If someone has had a stroke, doing CPR might help keep them alive until help gets there. Push hard and fast in the center of the chest, about 100 to 120 compressions per minute. If you don't know how to do CPR properly, the 911 operator can walk you through it. They will stay on the line and give you step-by-step instructions. Don't worry about doing CPR perfectly. Imperfect CPR is better than no CPR. The worst thing you can do is nothing. Step 9. Do not give medication. This is critical. Do not give the person any medication, even if you think it might help. Do not give them aspirin, even though aspirin thins blood and strokes are often caused by blood clots. The problem is you don't know what kind of stroke they're having. If it's an ischemic stroke caused by a clot, aspirin might help. But if it's a hemorrhagic stroke caused by bleeding in the brain, aspirin will make the bleeding worse and could kill them. Without a CT scan, there's no way to know which type it is. The same applies to any other medication they normally take. Don't give them their blood pressure medicine or diabetes medication or anything else unless emergency personnel tell you to. Medications that are normally safe can be dangerous during a stroke. Step 10. Do not give food or water. Do not let the person eat or drink anything, even if they ask for it. Stroke can cause weakness in the muscles used for swallowing. What feels like normal swallowing to them might not be working correctly. Food or liquid can go down the wrong pipe into the lungs instead of the stomach, causing choking or pneumonia. Even if they seem to be swallowing normally, don't risk it. They may need emergency procedures or medications that require an empty stomach. Wait until doctors say it's safe. Step 11. Do not let them drive. If the person insists they're fine and wants to drive themselves to the hospital, stop them. Take their keys if you have to. Stroke symptoms can be subtle at first and can get rapidly worse. Someone who seems mostly okay can lose consciousness while driving. They could kill themselves or others. This applies even if they seem insulted or angry. It's better to have them mad at you than dead. Call 911 even if they refuse. Tell them the ambulance is already coming and they might as well wait. Step 12. Stay calm. Everything above is easier to do if you stay calm. Panic makes you forget things, makes you make mistakes, makes you waste time. The person having the stroke is already frightened. If you're panicking too, you're making things worse. Take a breath. Speak slowly. Think through each step. It's okay to be scared, but don't let fear control your actions. You know what to do now. Do those things in order. The physical actions matter, but so does this. A calm presence helps everyone involved make better decisions. Paramedics can get better information from you if you're coherent. The person having the stroke will be less frightened if you seem confident help is coming. The window for effective stroke treatment is measured in hours, sometimes minutes. The drug TPA only works if given within 3 to 4.5 hours of symptom onset. Mechanical clot removal procedures work best within 6 hours, though they can sometimes be done up to 24 hours later in specific cases. Every 15 minutes of delay increases the odds of permanent disability or death. People who get to the hospital quickly and receive appropriate treatment often recover fully. People who wait or receive the wrong care often don't. The difference is usually not the severity of the initial stroke, but the speed and quality of the response. When you suspect a stroke, the correct response is immediate action. Call 911, note the time, gather information, and wait for help. If you enjoyed this video, please give it a thumbs up. Remember to share it with your loved ones so they also will know what to do and not do if someone they love is having a stroke. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. We're curious to know, did you know about these do's and don'ts during a stroke? Share with us in the comments below. Before you leave, you may also find some other helpful videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. See you in the next video. Bye.